Hello and welcome to the NNLM Showcase Symposium, a show and tell of projects that NNLM regional medical libraries, offices, and centers supported over the past few years. We hope that by attending the symposium, you'll be interested in applying for NNLM grants to support community engagement, identify and adapt projects presented to meet the needs of your community members, learn about how you can utilize NNLM and NNLM resources to meet your community's needs. A couple of housekeeping rules. By attending any and all sessions of the symposium, you agree to abide by the NNLM Code of Conduct. Failure to do so may result in your removal from the symposium. There will be an evaluation at the end of the symposium on day 3 that will be made available in the lobby during the last session of the program. We will also send an email to all registered attendees with the link to the evaluation. MLA CE code will be provided for you to claim continuing education credits for each of the sessions you attend. Our first presenter is Margot Malachowski. Margot is an education and outreach coordinator for the network of the National Library of Medicine in Region 7. Region 7 serves Connecticut, Maine, Massachusetts, New Hampshire, New York, Rhode Island, and Vermont. Margot has worked in public, hospital, and academic libraries since 1996. Margot will present how to apply for NNLM funding. Everyone, please welcome Margot.
Hey, everybody. Thanks, Tony. Again, my name is Margot Malachowski. My pronouns are she, her. And normally I would say that I'm coming to you from UMass Chan Medical School in Worcester, Massachusetts. Today we're having snow, sleet, and freezing rain, so I opted to do the presentation from home, which is in Western Massachusetts. And as Tony indicated, we're recording this webinar on January 24, 2024, and the recording will be available in a couple of weeks. We need to upload it to our YouTube channel, and so it will be available there. And again, even if you're not interested in CE, we'd love it if you fill out that evaluation form that will be available at the end of the showcase on Friday, and will also be emailed to all of the registrants. We do have you muted today to cut down on background noise, and the chat is disabled, so we'll be taking all questions and comments in the Q&A function in Zoom. And Tony's going to try to drop the link to the class description page in the Q&A. We're not exactly sure how this is going to work, but I'd like for you to have that link. Okay, so before we get into today's topic, just a word about who we are. The National Institutes of Health is the nation's leading medical research agency. The National Library of Medicine is an institute at the NIH. NLM is the world's largest biomedical library, which produces information resources such as PubMed, clinicaltrials.gov, and Medline Plus. NNLM, which is on the slide here, is the network of the National Library of Medicine. We are the outreach program for NLM. Outreach operates out of 7 regional medical libraries, or RMLs, and those RMLs offer training and funding opportunities to support equal access to biomedical information. On this slide here is a map of the United States with the RMLs numbered, and on the handout, which is on that link, available on the link, you'll find it is information on how to find your medical library. Finding your own regional medical library is especially important when you are applying for funding. So, Tony, were you able to drop the link? Yes. Excellent.
I think it should be available, but if not, if someone can put in another question, I'll be able to share the link that way multiple times if necessary.
Yeah, if you scroll down to the bottom of that web page, the link to both the slides and the handout are at the bottom of the page, where right before the green part of the web page. Okay, let's see. Here we go. This 1-hour webinar is designed as an introduction for proposal writing for beginners. We offer this webinar to help prepare you for NNLM funding opportunities. Again, we have 7 regions across the country, and each region operates a little differently. The National Library of Medicine has agreements with individual medical schools, and those schools make decisions about the funding at the regional level. We will show you how to check for your region for details about funding opportunities as we move through this webinar. So after this webinar, you should be able to apply for funding from NNLM, describe the basic sections of a proposal, identify types of documents necessary to include with a proposal, and recognize common mistakes of proposal writers. For additional information, we recommend the NNLM Proposal Writing Toolkit, and the link to that toolkit is on the handout. And I will also be referring to that toolkit throughout the webinar. So please let us know, I believe in the Q&A, if you've applied for funding from NNLM before, or this is the first time you're considering doing so. And maybe Tony could let me know what folks are saying.
Well, this one's a little harder to get responses for, Margot, mostly because the chat function is not available.
Okay.
So maybe,
All right, I'll move on from there.
yeah.
Okay. You might have an NNLM user account. You need a user account to register for our classes. To apply for funding, your organization needs to sign up for a membership account. This is free. You or another person at your organization will need to log in to your NNLM user account to fill out the NNLM member organization form. Each organizational member must designate a contact person to receive NNLM communications. This includes communication about funding opportunities and applications. Anyone in the organization can have an individual user account to participate in training. We just need one contact person for the organizational member. Your organization will be listed publicly in our membership directory. So we ask that you keep the directory up to date by reviewing your information annually and whenever changes occur in your organization. You can search for current funding opportunities at nnlm.gov/funding/RFA. This link is in the handout as well. NNLM provides funding for health information outreach, technology improvement, data management and services, and professional development. Funding amounts range from $2,000 to $20,000, and it all varies by region and type of award. On the web page, you will need to filter to your own region. On this slide is a screenshot of the web page with all of the checkboxes next to the regions numbered 1 through 7 checked. The website is defaulted to all boxes checked. Now you will note that there are 2 additional boxes that are not checked, and these represent 2 national centers that offer funding as well. The National Library of Medicine All of Us program and the National Center for Data Services. So you will need to uncheck all of the boxes except for your own region, or if you're applying to a center for funding, the center, before you start your search. Generally, your organization must be based in the region where you're seeking funding, or you're planning to do work in that region. Let's talk about what health-related project you'd like to do. The mission of the network of the National Library of Medicine is to, quote, advance the progress of medicine and improve the public health by providing all United States health professionals with equal access to biomedical information, and to improve the public's access to information to enable them to make informed decisions about their health. That's our mission, and we fund organizations that help us accomplish our mission. So maybe you want to support efforts to address social or environmental determinants of health. such as housing or food access in your community, or disaster preparedness. Or you could be looking to bridge the gap between researchers and patients by designing a participation in research project. You could be joining a community coalition to do a health promotion, such as walkable communities. Or what we commonly see here at NNLM is programs to teach self-management of chronic conditions through offering classes in how to use Medline Plus. A lot of libraries and community organizations do health screenings, like screenings for sexually transmitted infections, blood pressure, and diabetes. Libraries and community organizations offer peer support or social participation events, such as memory cafes for people with dementia or low sensory story times for people with autism. These are broad categories of ideas. If you are curious about what NNLM has funded in the past, please look at the NNLM Proposal Writing Toolkit. There is a link to a list of past funded projects under the Project Planning tab, and you can filter by organization types such as public library or faith-based organization. You might want to align your project with one of our current initiatives, such as confronting health misinformation, bridging the digital divide, or environmental determinants of health. So Tony, if you're able to drop the link to that class description page again, all of the links that I am talking about are included in the class handout. And if you scroll down to the bottom of that web page, you will see where you can download both the slides and the class handout. And please keep an eye out on our regional webinars for successful funding ideas. In March 2023, Region 7 showcased projects that focused on cancer prevention, and the link to the recording for that webinar is on our handout. And over the next few days, this showcase highlights many types of successfully funded projects. In fact, the next session today features Sophia, who's also on this slide here. So I hope you'll stick around for her presentation. Okay, so we've talked about the network of the National Library of Medicine, our mission, and the types of awards that we fund. Let's talk about how to get ready to write your proposal. Now, here is a big warning. The NNLM online application has no save feature. You cannot save and return to it later. We recommend that you become familiar with the requirements of the proposal and then draft each part in a Word doc or similar program. You can copy it into the online form in pieces when you're finished and keep a copy of that Word doc. You will find the requirements of the proposal in the RFP or RFA. I began this webinar by telling you a bunch of acronyms associated with the NIH, NLM, NNLM, RML. Now I will go over a few terms that you will come across when you are looking for funding. RFP is request for proposals. RFA is request for applications. And CFA is call for applications. And basically these things mean the same thing. I would say RFP is what you see most often. The National Institutes of Health prefers RFA, and what I've read is that an RFA has a more narrow focus. CFA is what you will see from the Robert Wood Johnson Foundation, which is an organization that funds very large health-related programs. Other terms include letter of intent or letter of inquiry. Not all funders require this, but this is a way for a funder to take the pulse of what applicants are planning on before they submit the full proposal. They will want to know who you are, what population you serve, what your general idea is, and a time frame. Not all funders require this. In Region 7, we don't, but I believe that Region 5, used to. I don't know if they still do, but I think in the past they have. But whatever funder you are applying to, if they ask for it, you should provide that. And then the letter of application is like a cover letter for a resume when you're job hunting. Tony, is there anything in the chat or Q&A that I need to, before I move on?
There's nothing in the Q&A showing up right now.
Okay, fine. Okay, the first item in your proposal is the evidence of need. And evidence of need is your community's need for a health-related project rather than your need for money. We will talk about that later. Funders want to make sure that you are serving the needs of your community. To prepare this part of the proposal, brainstorm about what you're seeing from your vantage point and your organization. And then you will want to look at publicly available data, and I will go through those options in a minute. Next, you'll want to get up from your own desk and talk to people, other people in the community, to see what they're seeing from their desks or their vantage points. Start with a list of community organizations that are involved with health promotions. For example, faith-based organizations, anti-poverty organizations, libraries, YMCAs, educators, food banks. What do they see? Lastly, consider talking with non-users of your organization. It might be interesting to hear from people who don't go to the library or people who don't attend the health-related programs that are offered at the senior center. In fact, word on the street that I'm hearing right now is baby boomers don't like the term senior center. And so they're not eager to attend something there, even though they're, age-wise qualified. So find out from their perspective, what are the barriers for them? Nothing about us without us. Now, if you're able to throw in the Q&A in the chat if you've ever heard this. This is a phrase that is used by disability activists, meaning that plans to address the needs of people with disabilities should include input from people with disabilities. I'm hearing this phrase with regards to all kinds of communities. So as you work on your proposal, please consult the representatives from the community that you hope to serve. Now, here are some publicly available resources to help you demonstrate evidence of need. These links are also on the handout, the links to every single thing except for the community health needs assessment, and I will talk more about that. The first is the Robert Wood Johnson Foundation's County Health Rankings website, which is an excellent source of county-level health data. Next is the U.S. Census data. The Rural Health Information Hub is an excellent resource if you are working in rural America. Not only does it include data, but it also has some toolkits with specific health topics in mind, and you can look through what are evidence-based programs that have already worked in other communities. Okay, so community health needs assessments are available from nonprofit hospitals. By law, these hospitals need to do an assessment every 3 years, and they are required to share their findings on their websites. But sometimes the assessments are kind of buried in the hospital website. It's not necessarily what they're going to put up front and center. So I recommend Googling the hospital name and community health needs assessment in quotes, or the county name and community health needs assessments, and usually that will get you there. Hospitals have done a lot of the groundwork of asking community organizations and individual community members about health needs. In fact, if you're struggling to think of other community organizations doing health-related programs, this is a great place to look. For-profit hospitals do not need to do this. It's actually a requirement of the IRS for nonprofit hospitals. If your nearest hospital is for-profit, you could cast your net wider to the nearest nonprofit to see if they have a community health needs assessment that resonates with your community, or you could search for a county assessment. Sometimes for-profit hospitals will do this type of assessment, so you could take a look at their website as well. Okay, back to my list. The Pew Research Center studies how Americans are using the internet, technology, and social media. Pew breaks this down by demographics, so you can learn about teens' preferences in social media, which is constantly changing, or trends in older adults using technology. If you're thinking about doing a program for youth or for people working with youth, look at the Annie E. Casey Foundation Kids Count data. And you could take a look at local urban planning organizations if you're working in an urban area. They are doing some great mapping projects, such as mapping in the city where the food deserts are or where there are pockets of poverty if you want to align your project with a specific area in your city. So those are the resources that I have. There's always others that are out there that people use. So if you want to share anything in the Q&A that's your favorite resource, that would be great. And we'll take a look at it later. Okay, so next the funder wants to read about your goals and objectives. We've talked about evidence of need. My favorite way to identify goals and objectives is through using a logic model. So here is a bare bones logic model. For more information about logic models, please check the link to our National Evaluation Center resources that are in the handout, or please join us tomorrow where the National Evaluation Center will be doing a session. On this slide is a table with 6 columns. We will work backwards in the table. So for our goal, we want to think big. For example, our goal is to improve health. The last column in this table is labeled long-term impact, and below it, it says improve health. Now, this is an especially large, sweeping goal. You might want to work on something a little more specific, but not too specific. So next, we work backwards in the table to our outcomes-based objectives. This gives our project more specificity. So if we move back to the next column labeled Intermediate Action Outcomes, that column lists Search Medline Plus as a sample action to get us to improved health. Maybe you're planning to invite community members or your staff to participate in training on accessing reputable health information from the National Library of Medicine. Or maybe the next item in that column, you'll be purchasing technology such as hotspots to loan or launching data services for biomedical research. And your intermediate action objectives are for your target population to utilize the library hotspots or consult librarian for data management. Let's move backwards to the next column labeled short-term knowledge/skills outcomes. In the short term, like a months-long project, which are the types that we fund, you'll want to focus on these short-term knowledge and skills outcomes rather than your big, broad impact of improving health. Because who knows if you're going to be able to improve the health of your community within a few months, right? But you could achieve some short-term outcomes. Your community members or your staff could learn how to identify, apply, produce. Think through what you are trying to achieve in terms of increased knowledge or skills. If we go backwards again to the column labeled outputs, this is where we identify our measurable outputs. How many attendees did you reach from your target population? How many staff did you train? How many hotspots did you circulate? How many data projects did you support? Now, under the column labeled activities, these are our process activities, such as coordinate with staff and/or community partners, develop the project, conduct the project, evaluate the project. Finally, in the first column labeled inputs, we have what we are starting with: staff, internal and external partners, time, and money. So we have our inputs and our activities for getting this project up and running. We have our measurables or outputs, and the short-term knowledge and skills outcomes, the intermediate action outcomes, and the long-term impact. Now, in some logic models, we account for our assumptions. For example, we're assuming that our community partners and our IT personnel will support this effort. We also might account for external factors such as weather, and these days especially rates of infection, which could really derail your project. So in sum, I encourage you not to go crazy with goals and objectives. If you have one sweeping goal and 2 or 3 objectives, that's great. We will talk more about measurables, goals, and objectives at the end of the webinar when I share excerpts from a successful proposal. Now, Tony, is there anything else anything going on I should know about?
Well, Benny has shared one resource that she really likes is the City Health Dashboard, and
Mm,
shared the link to that in the Q&A section.
great, thanks. Okay, so you're going to need to demonstrate the way you're thinking about your process through a project timeline. For example, your proposal states that you're going to hold a kickoff meeting in May and develop the project over the summer, hold trainings from September to February, and evaluate everything in March. So you are letting us know in the proposal that in March you will sit down and figure out the extent to which you are able to implement your project as planned, how much community interest you generated, and if there were any situational factors such as IT problems or the weather that impacted your outcomes and how you adjusted for that. We do expect things to change over time, so we'd like to hear how you managed that unexpected change. At the end of the project, you will submit a final report. NNLM asks for additional documents such as a resume or curriculum vitae or CV for each person that is working directly on the project. These documents show the funder that the people involved have the skills to implement the project. If you are working with community partners, which we encourage you to do, identify them and get letters of support. You could say that you're working with the YMCA, but if the funder doesn't see a letter of support, they might wonder if the YMCA even knows that you are thinking about working with them. You want to include a detailed budget. You want to identify what you need and how much you need. And I will talk more about the budget in a few minutes. You will want a narrative or justification of the budget, as well as a table of the budget. You will need to include an evaluation plan and a continuation plan. And what I mean by continuation is that most funders are expecting that they are giving you seed money to try out an idea, but they don't anticipate that they will be able to fund you year after year. They want to see that you're diversifying your funding streams to continue this work, or that you will take the results of this work to your organization and make a bid to have it covered in next year's budget. For evaluation planning, I highly recommend first that you attend tomorrow's session, but also check out the website from our National Evaluation Center at nnlm.gov/nec/eval-design. We don't have time in this session to go over these resources, but this webpage will go over community assessment, logic models, measurable outcomes, and how to develop an evaluation plan. There are some great ideas for working with specific populations such as K through 12 students, LGBTQIA+ folks, diverse communities, and folks living in rural America.
Margot,
Yeah.
we do have a question.
Okay.
Someone wants to know the difference between a letter of support and a letter of intent. They've mentioned, I've heard some funders, like the NLM, preferred letters of intent.
Okay, so a letter of intent happens before you submit the proposal. And this is a way for a funder to kind of just get a general idea of what you're thinking about. And not all regions at NNLM require this. Region 7 does not, but I believe at one point in time, at least, Region 5 did. So that's why you really need to check in with your regional medical library to find out what their requirements are. Now, a letter of application is like a cover letter when you're submitting a resume for a job. And so it's very similar. This is this is who we are, and this is what we're planning to do. But it just gives you a little more time to explain yourself, I guess.
In the letter of support,
Oh, I'm sorry. The letter of support. The letter of support is when you ask if you're going to work with a community partner, and you mention them in your proposal, we will want to see a letter of support from that organization saying, yes, we support so and so in doing this project, and this is the way in which we're partnering with them. Some folks also like to have a letter of support, like if you are not the director of the public library and your library is applying for the grant, you might want the director to write a letter of support saying, I know that my person here has applied for this grant, and I support them in doing this work, and I will make sure they have the time to do this work, that kind of thing.
I will add that with the letter of intent, if it is required, sometimes the funder needs that letter of intent because it tells them how many peer reviewers they may need to
Hmm.
locate as well. So that is another reason why they may require a letter of intent. But there is another question that came in.
Mhm.
Could someone submit an application to any region, or is it restricted to your region?
The idea is we're funding work within our region. So if you are residing or working in one region, but your work is going to occur in another region, then it would be reasonable for you to submit an application. But generally, we wouldn't fund somebody from outside our region to do work outside the region. Now, we do have some national programs, and they operate differently.
Someone had mentioned they can always submit, but it might not get funded as well.
Mhm.
So that is another thing that exists. So it never hurts if you're outside of the region to contact that regional medical library directly to get their feedback as well prior to spending the time to writing your application too.
Yeah, absolutely. We're always happy to talk to folks. Okay, so shall I move on to the budget? So first thing, look at the RFP or RFA, and this is true for any funding application, to find out what is allowed and what is not allowed. NNLM does not allow funds to be used for food, furniture, or swag, such as t-shirts or water bottles with your logo on them. We know that food is a big draw for community programs, so please plan on other funds covering that. Other funders might have different restrictions. And make sure you mention the need for the items in your narrative. There's a budget narrative or budget justification in the proposal. And again, as Tony was saying, please contact the funder with any questions you might have. We once had an applicant who they were at a public library and wanted to buy a table that was wired so you could plug in your devices. And they were like, well, is this technology or is it furniture? And we came to the conclusion that it was furniture. And so we wouldn't be allowed to fund that. You'll want to be thorough when writing your budget. You want to create a table with line items. Sometimes the proposal will include like an Excel spreadsheet or something for you to fill out, or you can create your own table. This is what we need, and this is how much it costs. For personnel, we will want to know the number of hours dedicated to the project and the costs per hour. And this is where you really need to talk to the folks that handle grants at your organization. Do not assume that you can submit a grant on your own. And I am speaking from personal experience. In a previous job, I thought I could just apply for a grant on my own, and I learned otherwise. So to get a clear picture of personnel costs, you need to think bigger than the person's salary per hour. Personnel have benefits, which should be included. And then basically the same thing for consultant costs. We'll want to know the number of hours and the charge per hour. You'll want to identify any equipment that you hope to purchase with the funds, laptops, tablets, headsets, and any supplies that you need. And you will want to calculate your travel costs, numbers of miles, and costs per mile. And then there are indirect costs, which confused me when I was first writing for grants. Sometimes called facilities and administration costs, this acknowledges that your organization by rights can take a percentage of the grant for processing the money for you and for covering costs associated with using your facility, such as electricity. So NNLM does not fund individual people. We fund organizations. The check goes into your organization's system. And if you're working in a small organization, some funders will only work with organizations that have a 501c3 nonprofit status. So sometimes these smaller organizations will partner with a larger nonprofit to handle their money. And that larger nonprofit will receive the indirect costs for processing the money. So I wanted to give you a heads up about that because that was something I did not understand at first. Oops. Go.
Before we
Yeah.
uh, change, there is a question that came in. Is funding for survey building web apps like JotForm, Qualtrics, SurveyMonkey allowed?
Yes. Yes. That type of thing has been funded in the past. So you could go ahead and submit something like that.
And I would always recommend looking at that proposal writing toolkit on the
Mm-hmm.
budget tab there. There is a link to allowable costs. So you can go through that and locate items that if you're not sure if it could be funded or not, you can check to see if it's allowable or unallowable as an expense. But you can always reach out to your regional medical library with those questions as well.
Yes, and be careful with your numbers when you're doing the budget. Make sure they add up. And please make sure that the numbers are equal to or less than what the funder is offering. If the funder is offering $5,000 or $10,000, don't ask for more. Every year we get requests for more money, and automatically we have to put them in the maybe pile because we're not sure they can run their project with less money. And if we really like their idea, and this has happened, we give their proposal back and we tell them to redo their budget. So it's kind of a time waster on everybody's part. So just when you're submitting, make sure you're under or equal to the limit. Okay, mistakes. These are the 5 common mistakes. And the first one is waiting until the last minute to gather information. So based on everything we've talked about today, you'll see that a good proposal does not happen quickly, but I know it is tempting. When you see an email in your inbox or someone tells you about an opportunity, but maybe there's only 2 weeks until it's due, to really want to throw something together. My advice is to either like clear your desk of all other responsibilities so that you can put your full energy into it, Or if it's an opportunity that comes up every year, to consider learning about the requirements and waiting until next year to apply, because it does take some time. The second common mistake that people make is proposing an idea that doesn't match with the purpose of the award. And some of this is due to your organization's just basic need for funding and the hope that this source will work. But if you read through what the funders are looking for, you might find that your project really does not match. So please read the requirements carefully before you put a lot of work into the proposal. And Tony mentioned this earlier. These do take time. And before you sink a lot of time into it, make sure you're aligned with the mission of the organization. The third mistake is similar, and this is ignoring the instructions when writing the proposal. Reviewers are looking through a lot of proposals, so following the instructions goes a long way in helping the reviewers do their job. The fourth is creating a budget that doesn't match up with the narrative. You want to create those line items. This is what I need for my project. And then you'll want to make sure that those line items are talked about in the narrative of your proposal so they don't seem to come from out of nowhere. And the last common mistake is assuming that the reviewers are experts in your community or field of expertise. Many times, funders will ask outside partners to help them review funding proposals. And here at NNLM, as Tony mentioned, we will ask other people to help us review. So we'll ask previously funded partners or librarians or others working in health-related fields and public health and such to help us decide if a project has merit and deserves funding. So we might already know you, but the other reviewers might not. So we recommend you give basic information about your community, the health needs of your community, and how your community will benefit from your project. So I encourage you to check out that toolkit that Tony was talking about for more details on how NNLM rates your proposal. Here are the key elements, and the toolkit goes into much more detail, but here's the checklist of what we are looking for. Does the proposal make a significant contribution to the mission of NNLM? Does the proposal explain the need for the project, including demographic information about the target population or the geographic area? Does the proposal show the logic and feasibility of the technical approach to reaching the target group or community? Does the proposal include a timeline or an implementation schedule for major events and activities? Does the project include National Library of Medicine resources or address network of the National Library of Medicine initiatives? Is there an evaluation plan? Does the plan make sense given the goals and objectives? Does the proposal clearly outline the qualifications, roles, and time commitment of the project staff? Is the proposed budget within the funding limits? Is the budget justification sound? Does the project promote diversity, equity, and inclusion? Please check the toolkit for a list of populations that we are hoping to serve in terms of equity, diversity, equity, and inclusion. We have a long list of people that we hope to reach through your projects. Reviewers are given the opportunity to comment on the strengths and weaknesses of a proposal. So if your proposal is not accepted, please look at those comments and think about how you could rectify those weaknesses for a future submission. So I want to end this webinar with a few excerpts from a successful proposal in 2019. We funded a project in Region 7 called Dementia Friendly Nahant. Nahant is a small town on the Massachusetts coast. So I'm going to quote from the introduction to the proposal. Dementia Friendly Nahant brings the national Dementia Friendly America model to the local level. Nahant has an aging population with an estimated 102 people experiencing some form of dementia and an estimated 168 people, often family members, caring for them. This means dementia impacts nearly 8% of Nahant's population. And as the population continues to age, this percentage will continue to rise. The Dementia Friendly Nahant project enlists the services of the library, the Council on Aging, the Nahant Village Church, and the Greater Lynn Senior Services to provide materials, services, and programs for people with dementia and their caregivers. We hope to create meaningful experiences and decrease feelings of isolation in affected families while increasing understanding in the Nahant community. So I'm going to go over some of the data that they included in their proposal, just to give you an idea, and also to kind of tease out what they did, and also to look at their objectives. So the proposal was supported by 3 data sources. The first was census data. And again, this proposal came to us in 2019. So it was based on 2010 United States Census data. Nahant is a small community with an aging population. As the baby boom generation is expected to live to be 80 years or older, an increased percentage of the population will be experiencing dementia within the next 10 years. And they included a citation, and I believe even a visual. Then they included data from the local community health needs assessment. In the community health needs assessment by Spalding Rehabilitation, dementia was mentioned as one of several mental health issues for the Massachusetts North Shore, and they included the citation. So they were showing that they were addressing a need that was already established by the local hospital. And then they had some internal observations, which is perfectly fine to do. One patron periodically comes into the library, pleasantly asking same questions of the library staff at each visit, not remembering what he had asked before. So there's lots of ways you could include some, from your desk experiences to say, yes, this is something we are seeing in our location. So the goal was to support dementia-friendly Nahant, and the proposal included 3 objectives. So it can briefly think about what the measurable outcomes would be for each. So objective 1 was offer circulating materials in a variety of formats that are easily understood by and inviting to patrons with cognitive difficulties, in order to afford these patrons positive interactions with literature and music, and to improve mental health and quality of life. Now, measuring circulating materials in the library world is one of the easiest ways to collect data. You can just you can identify what materials are fall under this dementia-friendly project, and then watch the circulation counts for those. Objective 2, provide authoritative information on diagnosis, treatment, and coping strategies to people with cognitive loss, their caregivers, and the public using the website Medline Plus. This is a little trickier to measure, and one way you could do that is if at a reference desk, if you were demonstrating Medline Plus to patrons coming in, you could do like a hash mark for a certain period of time during the project, just to measure how many times you use that resource. Also, there's some really great printable resources that are linked in Medline Plus. And when I used to go to health fairs, I would print out materials and I would count how many I had printed out. And then after the health fair, I would count how many I'd left. And that was an easy way for me to keep track of how many materials I had distributed. So that's just one way to think about measuring. And the third objective, and I'm going to argue that this is actually 3 and 4, is host a monthly memory cafe for people with cognitive cognitive loss and their caregivers, and host a town-wide read for the community to foster meaningful socialization and education, reduce feelings of isolation, and improve social behavior and quality of life. Now, I can see why the applicant put this in as one objective because they're both kind of community outreach efforts. But instead, I would probably separate them and say there's the monthly memory cafe, and you could track how many attendees you had. And then the townwide read might be your opportunity again to count how many people were participants. But both of these, you could also gather some comments or questions that people had to give us a feel for how the dialogue was going in your community as a result of your project. So this proposal included 3 letters of support, and each letter was written on letterhead and then scanned and uploaded as a PDF. And the content was very simple, and the purpose is very simple. These partners were offering to provide refreshments. Remember, I said we don't cover food. So one of these organizations said they could provide the food for the memory cafes, for example, and to give guidance to the library staff. The senior services said they could give guidance to the library staff on working with patrons with dementia and their families, and announce the events through their own channels. The church, the Council on Aging said we can also publicize your events. And so based on these letters of support, we know that these organizations are true partners of the applicant, and it made for a very strong proposal. So that's what I've got for you today. As a reminder, to receive the continuing education credits from the Medical Library Association, please fill out the evaluation form that you will receive at the end of the showcase on Friday. And the evaluation form will also be emailed to all of the registrants for the showcase in case you're not in attendance on Friday, although I encourage you to stick around and learn with us. So thank you very much for your attention. And Tony, are there any more questions or things I can answer?
No, I don't see any other questions that showed up. I know that there have been a few things in the Q&A that popped up, so I think it was a great session.
Okay, I'll
We do
stop
have a
sharing.
couple of minutes in case anyone would like to add any questions while we still have Margot available.
And as I said, we do have some examples of funded projects over the next few days, as well as a how-to on the evaluation that I barely touched on.
Well, one question that I get, oh, here's a question. What is the best way to keep track of upcoming grants? I was hoping to apply for a health literacy type of grant, and I'm not seeing that it's open this current cycle. Um, that's kind of close to the question that I was thinking about.
Mhm.
But for me, since I'm the executive director for Region 1, what I'll say is each regional medical library has their own cycle in which they have an open call for projects. They do advertise that as well through social media. I think many of us have our own newsletters, so you can subscribe to our newsletters as
Mhm.
well to find out when those calls are available. Region 1's is not available just yet. We hope to announce ours, say, next month, actually. But I know Region 7's had theirs available earlier this fall. So reaching out to each regional medical library and saying, just checking to say, hey, I'm interested in funding. When will applications be open? You'll hear back from them and just follow up with them regularly. Another question came in of what content should be included in the letter of intent. This is not the letter of support, but the letter of intent.
It's just, this is our organization. This is just the gist of what we're hoping to do. This is the population we're hoping to serve. And as Tony said, just gives us like a heads up on what you're planning and that you are planning on submitting. So it doesn't have to be in depth.
Can you tell us where this information can be found after the session? And I think I have the class page that I will share again.
So on that class page at the bottom of the page, before you get to the green area, there are two links. One is for the slides and one is for the handout. And the handout has the links to all of the resources I was mentioning today.
So let me type the answer for you so that you can access both the presentation and the handout. And that should show up in the answered section for you now. So this was answered. Um, and another comment thanking us for the session.
Mhm.
So they found that very helpful. Um, and apologies, I live near a hospital and I also have COVID if I sound funny. So um, any other questions? Thank you
Okay.
so much, Margot. I think you
Yeah.
did a wonderful job explaining all of our funding that we might have available. So
Yeah.
um, if you're in my region, please be on the lookout for our call for applications within the next month or so. So thank you.
All right. Thanks, everybody.
Hopefully you can attend the other sessions that we have scheduled. Who do we have in the next hour? Marco, do you
We
know?
have Sophia doing breast cancer awareness for women of color.
And that's out of Region 7.
It
So
was, and wonderful story there.
it's a great project too, actually.
Hmm.
And Jessica mentions that Region 7 has technology awards that are currently open. So if you're in Region
Ah,
7, I hope you apply. Please apply. I know Jessica would love to fund some great projects out there.
yeah.
So, all right. Thank you all and see you at the next session soon.
All right. Bye-bye, everybody.
Bye.